Welcome to KingsbergMedical, where we specialize in a safe, very effective, beneficial testosterone replacement therapy program. In order to qualify, you must suffer from the symptoms of a low or deficient level of testosterone, which might be a low energy level, loss of sex drive, loss of concentration or mental focus, a loss of overall sense of well-being. Of course, we need current lab work that shows your testosterone levels in order to prescribe. Some of the benefits you can expect to receive when starting your testosterone therapy program will be an increase in energy level, an increase in sex drive. Mental clarity will come back, the ability to make quick decisions. Your overall sense of well-being will come back to you. In order to make this a very safe therapy, we incorporate certain medicines as a precautionary measure to prevent any side effects. The first one would be HCG. This stands for human chorionic gonadotropin. This simply stimulates your natural production of testosterone. While incorporating testosterone therapy, your body will want to naturally slow down its own production, if not shut off when the levels get too high. When we incorporate HCG, it simply stimulates your natural production of testosterone even during high levels. The next side effect, most frowned upon in the medical field, would be the way that the body converts extra testosterone into estrogen. Okay, we incorporate a medicine called anastrozole. This is an anti-estrogen aromatase inhibitor. This simply prevents your body from doing something known as aromatizing, which means when your body converts extra testosterone into estrogen. High estrogen levels can lead to a side effect known as gynecomastia. This is a buildup of breast tissue. High estrogen levels can also lead to oily skin and acne. We incorporate a certain milligram anastrozole capsule into every testosterone therapy program due to your levels of estrogen in your lab work. This will simply keep you from ever suffering from gynecomastia or oily skin and or acne. Now we're going to show you how to inject and take these medications properly and safely. Gary McCord, who's currently on the testosterone therapy program here at KingsbergMedical, is going to show you how to do so.
Hi, I'm Gary. I'm going to take you through the steps of preparing the medications for your testosterone therapy and do the injections. Your testosterone therapy is going to consist of a few medications. First is going to be the HCG, then your testosterone, a B12, and an anti-estrogen, anastrozole. The first thing that we're going to do is to prepare the HCG for the injection. The first thing that you want to do is to take the bacteriostatic water, pop the top off of that, and then on the HCG, as you can see in the middle, it's got the pull tab. You just want to pull up on that, pull it off, and that'll show you the rubber stopper. Next, you're going to take your 10 ml syringe that was provided for you, and you're going to take the needle tip and turn the needle tip clockwise and turn it onto the syringe. Next, you're going to take the bacteriostatic water, hold the bottle upside down, and then pull the sheath to reveal the needle. What you're going to do, since we're adding 11 mLs of water, we're going to pull the plunger all the way back, filling it up with 10 mLs of air. We're going to inject the needle and compress that 10 mLs of air into the bottle of bacteriostatic water. And then you're simply just going to pull out 10 mLs of the bacteriostatic water. Next, you're going to take the HCG vial, and when you inject the needle, you want to do it at an angle so that the water runs down the wall of the vial and not directly on the medication. You're then going to have to add 1 more ml of the bacteriostatic water so that you have the full 11 mLs of water. Again, we'll pull the plunger back just past the 1. Inject it into the bacteriostatic water and draw out the 1 ml solution. Be sure that when you're measuring it, the top of the plunger is the mark that you're looking for. And then just simply add that into the HCG vial. Now to mix the solution, you never want to shake it. You simply place the vial in between your hands, rub your hands back and forth for about 20 to 30 seconds, and you'll see that the solution will start to clear up and look like water. Once the solution is prepared, you're going to take your insulin syringe, remove the end cap, and then remove the sheath, revealing the needle. And then we're simply going to pull back your dosage, which would be 250 units. So you would pull the plunger back to the 25 mark. And then again, put the needle into the vial, press it in, and then slowly draw out 25 units of the HCG. And then recap the syringe, the needle, and put that off to the side until you're ready to do the injection. The next medication that we'll prepare is going to be the B12. The B12 is going to be the same procedure as the HCG. It has the plug in the center. We're simply going to pull that up and reveal the rubber stopper. And again, you're going to use the insulin syringe, but this time we're going to use a full syringe. So take the cap off. You're going to pull the plunger all the way back to just past the 100 unit mark. Inject the needle into the vial, compress that air, and then draw out a full syringe of the B12. And again, replace the sheath on the needle and you place it to the side for injection. With the testosterone, you're going to use one needle to draw it out and another needle for injection. So just like with the other two, the bottle that has the centerpiece that you need to pop off to of course reveal the rubber stopper. And you just want to wipe the top of that with the alcohol swab. Now you're going to take the syringe that's provided, which is a 3 ml 20 gauge needle tip. So you're going to go ahead and open that up. And as you see, when you pull the sheath off of this needle, it's a larger needle, which is going to make it easier for the testosterone to go in the syringe. So if your dosage is 1 ml, you're just simply going to pull the plunger down right past that 1, and as you can see, it's the top part of the plunger that's on the 1 mark. You're going to inject the needle into the testosterone vial, compress that 1 ml of air in there, and then slowly draw out 1 ml. Once you have the 1 ml loaded in the syringe, you want to put the cap back on, and then pull the plunger down until all of the fluid comes out of the needle into the syringe. Now you're simply just going to turn the sheath and the needle counterclockwise and remove that needle. You can put that off to the side, that can be disposed of. You're then going to take your 23 gauge needle, open that up, and just simply screw that on. Now once you screw on the 23 gauge tip, you want to hold the syringe upright and slowly press the plunger up, and you will see the fluid come in to the tip of the syringe. You just want to press it slowly until one little drop. You want to push up the plunger slowly until the medication fills into the needle, and you'll see one drop come out. Once that one drop is there, then it's ready. You want to recap it until you're ready for the injection. The final part of your testosterone therapy will begin in your 13th week. That is known as your post-cycle. It's going to include 2 medications. One is the HCG that you have been taking along with the testosterone, and the other is clomiphene. So it will be the HCG that you have used during the therapy at a higher dose, and the clomiphene, which is a capsule like your anti-estrogen that you had taken. Again, your advisor will tell you and inform you of what your dosage would be for both the HCG and the clomiphene for the post-cycle therapy. The final thing that we will have in the testosterone therapy is your anti-estrogen capsule. This is simply just a capsule that you will take during your therapy. For your testosterone injection, the easiest, most comfortable spot is going to be your gluteus muscle. So what we want to do is to measure, you want to take your pinky and your thumb, holding them out from your hand, and you're simply going to place the pinky at the top of the crest in your glute, and where your thumb lands is going to be the injection site. So what we want to do is just take the alcohol swab, clean the area. You're going to remove the cap from the needle, and then again, if you want to recheck the pinky at the top of the crest, right where your thumb is, that's going to be the area that we inject, where we cleaned. And you're simply just going to take the needle. Make sure that you're not putting weight on the leg that you're injecting. You don't want to have weight on it. So take the weight off of it, simply push it in, press, plunger, and once it's in, simply going to remove it. To prepare for your HCG injection, you simply want to take an alcohol swab, and you're going to clean the area. You're going to take the HCG in the stomach 3 inches to the left or 3 inches to the right of the belly button. Pinch, and then just take the injection sideways here. And that's it. For your B12 injection, you're going to inject into the shoulder region. So we want to take the alcohol swab, clean the shoulder, and you're simply going to remove the cap, exposing the needle, and then you're simply going to go right off center, inject it, and just compress it. Press it all the way in, and then pull out. If when you pull it out, there shouldn't be any blood. If there is, you're just going to wipe it with a cotton ball, alcohol swab, and put a Band-Aid on it.
Once you've been on your testosterone therapy program for a certain amount of time, the doctor will determine when it's time for you to do a post-cycle therapy. In order to start your post-cycle therapy, you need a 2-week break after your last testosterone injection. During this 2 weeks, the only thing you'll be doing is injectable B12. The vitamin B12 is great for brain system function, immune system support, and energy levels. After this 2-week period of time, you'll start to incorporate HCG at 1,000 units a day for 11 days straight. Also during this time, you'll be incorporating clomiphene. It's a tablet that you'll take once a day. This will simply recalibrate your luteinizing hormone and reset everything that has anything to do with testosterone production in your natural system. In order to bring you on as a patient, we need 3 items to complete your file. One would be the medical history form you can fill out on our website. You just simply click on medical history form, fill it out completely, hit submit, it will automatically come into our database. 2 would be a physical, and 3 lab work. Now, if you have a current physical and lab work that you've had done with your doctor, we should be able to use it. If you haven't, we can simply schedule you an appointment with one of our doctors in your area to get a current physical and lab work done at your convenience. If you have any questions that haven't been answered throughout this video, remember you can call at any time. One of our professional, highly trained medical advisors will be here to assist you. We'd like to thank you for choosing Kingsberg Medical, where it's our goal to improve the quality of your life. Remember, we all have to age, but we don't have to feel it.